Coronavirus, COVID-19. Here's what you need to know. Can you explain to us what is the coronavirus, sir?
Sure. So the coronavirus, it's actually a family of viruses, and it's quite large. Other examples of the coronavirus are the virus that causes the common cold, for example. That's also a coronavirus. This particular coronavirus that we have been hearing so much about recently is a novel coronavirus, which means it hasn't been around, spread from person to person before. That's part of the reason why everyone is so concerned about it, is because it's new.
Cool. All right, next question. For you, sir. Okay. Now, how bad is the coronavirus, really?
Okay, so this probably is the question that everybody is concerned about, right? So the disease COVID-19, for the most part, leads to mild upper respiratory symptoms, fever, cough, that kind of thing. And it is usually self-limiting, so people usually get better. Similar to the common cold or the seasonal flu virus, for example. In a minority of cases, it can lead to serious disease, such as pneumonia, and in a few cases, it has led to death. So it can be serious, and that's part of the reason why we're concerned about containing it. We don't want it to impact our service members or their families or other DoD employees. So we're making a lot of effort to contain the virus. But for the most part, people who come down with COVID-19 will experience mild upper respiratory symptoms.
Oh, I see. Who would you say is more susceptible to becoming infected by the virus?
So severe disease seems to occur more frequently in the elderly or people with other medical conditions that make them more susceptible, such as heart disease or lung disease, things of that nature. If their immune system is compromised in some way, then they might experience more complications of the disease.
Next question. Now, sir, what would you say is the best way to prevent the virus?
So as a preventive medicine physician, I love this question because it's true that many diseases can be prevented, and COVID-19 is not an exception. So the information that I constantly push about this is that the methods that keep us safe from other respiratory illnesses such as flu or cold will also protect us from COVID-19. And that's just simply practicing good hand hygiene. Always washing your hands, especially before you eat, after you use the bathroom. Certainly limit touching your face, your eyes, your nose, your mouth. You want to practice good cough etiquette. You don't want to slime people with your sneezes or coughs. So the best way to do that is to do the dab, or some people say, to cough into your sleeve or into a tissue and then discard that tissue. You don't want to be coughing on your hands and then touching things with your hands, or shaking people's hands, right? So cover your cough. And if somebody else is sick, make sure that you keep your distance. We call that social distancing. Common surface areas, you want to clean them with a sanitizing solution. And if you're sick with any upper respiratory infection, such as cold or flu, stay home. Don't go somewhere. Don't participate in social gatherings. Don't go to work. Don't go to school and infect other people. So these preventive health measures are the same for COVID-19 as they are for any other respiratory illness.
What's your views on utilizing face masks for preventing infection?
So that is a good question. I think that the consensus is that face masks that are commonly worn, like surgical masks, they don't filter the air. They don't significantly protect you from airborne respiratory particles like those that spread the COVID-19 virus. They may be beneficial in that they keep people from touching their face when they're wearing them. Certainly they aren't hurting anything. So if you're sick, it probably provides an additional barrier for whatever you're coughing and sneezing that might help other people from becoming infected who are around you. So in the medical treatment facility, for example, if somebody comes in with symptoms of cough or fever or other respiratory symptoms, we would probably give them a mask and tell them to put it on. But for the general population, if you're using the other preventive health measures that I already covered, you're probably doing what you need to do to protect yourself and others.
How do I know if I just have the cold?
Okay, well, the short answer to that is it's impossible to know, and there are multiple viruses that could cause the common cold. So if you were exposed to COVID-19 and you experience mild symptoms, like many people will, you might think that you have the common cold. And in fact, it'll go away just like the common cold would. Really, the way that we are identifying cases right now, we are using either a travel history to an affected area. Right now that's predominantly China, and that might change in the future, but or a link to someone, so close contact with someone who is known to have the virus. And that's really the best way that we can use to identify people with COVID-19 disease right now.
What are we using to confirm cases of coronavirus? How's the testing process for this?
So there is a test that's been developed by the Centers for Disease Control and Prevention, and that test is not widely available yet, but we do have the capability here in Japan of taking samples and sending them to the CDC for testing. That test will be more widely available in the future as more and more places get the equipment that they need to do that test. There is always the local test that is available here in Japan, which has the same source. So we can utilize local public health authorities. We can ask them to run tests for us, and that's been working so far just fine. We actually haven't had to test many people for it.
So if I'm experiencing some cold symptoms and I am still going to work and surrounded by my family or friends, at what point do you suggest that we should get checked out or run to the hospital and get seen?
Good question. First of all, I'd say that if you do have cold symptoms, then it would probably be better for you to stay home. That's social distancing and prevents other people from becoming infected. But if you are just experiencing cold symptoms and they're relatively mild, then there's no reason to run to the hospital. We would encourage anyone who has fever, cough, maybe difficulty breathing, who needs to seek medical attention, we would encourage you to call ahead first and let them know about your symptoms and your travel or exposure history. So if you have been in close contact with someone who you know has the coronavirus, or you have traveled to an area where cases are increasing, such as China, Hong Kong, Macau, and right now the Republic of Korea is in that boat as well, then you need to let the military treatment facility, the medical treatment facility, know about that history so that they can be prepared to treat you appropriately. For the most part, people who are experiencing cold symptoms probably don't have COVID-19 at this time.
What would we say are some common myths about the coronavirus?
Okay, so misinformation about COVID-19, about this coronavirus, is rampant on the internet, and I don't know if I could do justice to very many of them in the short time that we have. But I have heard that People say you get it from bat soup. I think there was a video online where some lady was eating a bat, and people think that that's how it spread. Well, we do know that this coronavirus is part of a subfamily of coronaviruses that do originate in bats. However, it probably didn't start from bat soup. It seems to have started from live animal markets in China, and it's probably spread from bats to another animal that was sold at that market and then spread into humans. And coronaviruses can do that. They can occasionally, and in this case, this is what happened. They went from an animal reservoir into a human population, and now they're spreading person to person. So, so that's a myth. There are some concerns about whether or not you can get the coronavirus from your pet or give the coronavirus to your pet. And I would say that there are some unknowns about that at this time. We don't know that that occurs. It may occur, but probably not a major driver of this outbreak. We're most concerned about person-to-person spread. If you have specific questions about whether or not your pet might be infected or whether you can get the coronavirus from your pet, then I would direct you to the CDC website for good information about that, or contact your public health authorities. There are veterinary services available within the Department of Defense, so I would encourage you to seek information. So another myth that I've heard about is that the coronavirus, this novel coronavirus, was created in a lab and then released deliberately. And that was based on some information that there might have been a patent that had been created for a coronavirus. Well, there is a patent. It was a patent on research that was done on a previously discovered coronavirus. That's not this coronavirus. In fact, the information that we have available seems to suggest that, as I mentioned before, that the source of this coronavirus was an animal reservoir that spread from animals to humans in some of these live animal markets in China. All of the research points to that right now as being the source, and there's no evidence or indication that this is a deliberate release. That's been pretty well debunked.
Yes, sir. So, sir, what would you say the changes to the health protection conditions mean to us?
Okay, good question. So, the health protection condition, or HPCON construct, mirrors the force protection condition construct that we use to keep our military members safe. And HPCON Bravo specifically is what has been recently adopted by the commander of U.S. Forces Japan. But this is simply a preparedness and response posture to a moderate risk of exposure to this illness. So we know that it's spreading outside of China from person to person in some of the communities around our military bases. So we want to be prepared for that and make sure that we are doing the things that we need to protect ourselves against the virus and to protect our mission capabilities, right? So with HPCON Bravo, some of the things that I already talked about, making sure that we have sufficient supplies, making sure that people who are experiencing illness practice those prevention measures, and making sure that message is widely disseminated, making sure that we limit unnecessary travel to affected areas, or we limit large social gatherings where the risk of exposure might be higher. All of those things are considered when we elevate the health protection condition. And And so that's what we're doing here and elsewhere as well. For all of you out there, stay informed, stay vigilant, and stay healthy.